I always liken the smile and the teeth to the rings of a tree. We can tell so much about a patient's overall health just by their mouth and their teeth. Things that are going on systemically in the body a lot of times will show up first in the mouth. And to that point, the mouth is also one of the first places that aging shows up. Our mouths are the most used part of the body as well. We're constantly eating and chewing and talking. So the mouth, does take a brunt of the force. It is something that when isn't healthy can really affect someone's function as well. Eating, speaking, all those things. I think it's always a combination of genetics and lifestyle. I think we can, in some ways, control our genetics in a way. Yes, we're predisposed to things, but genes can be turned on and off based on external factors. So it's the whole field of epigenetics, right? Which is so cool. And just because you have a genetic predisposition to something, you can actually reduce your chance of turning that gene on by taking better care of yourself, by your external surroundings. So, when it comes to oral health, I think, some people are just genetically predisposed to a certain condition or to, say, periodontal disease or, cavities. But I do believe that, you can, in most instances, curtail that, the effects of that, maybe not eliminate it completely, but certainly control the degree or the magnitude to which that gene is expressed. So I do believe we have a bit of control over what happens in our bodies, our mouths, even with genetic predispositions. That's a good question. What are porcelain veneers? Porcelain veneers are thin shells of porcelain that are bonded onto your teeth. Porcelain is a glass-like material that on its own is actually quite fragile, but when you bond it to a tooth, it gains so much strength it almost becomes as strong as your own natural tooth. And the things we could do with porcelain veneers are, we can brighten the smile. We can make your teeth brighter than they would naturally get with whitening. We can change the shape of the teeth. So if you're not happy with the shape of the teeth, we can change that, make them larger, smaller, more feminine, more masculine with straighter edges, or feminine with rounder edges. We can broaden the smile, widen it for more cheek support and fill in any dark negative spaces on the sides of your smile. And in answer to your question, how many porcelain veneers does someone need? It depends. Every patient is different. We really need to evaluate their smile, their face, what it is exactly that their goals are with their smile. Typically, I'd say for a smile makeover, the least I would do is 4 veneers, and that's a very conservative, simple case. If somebody really loves their smile and maybe has some old bonding, old filling material in the front 4 teeth, and we just kind of do, a mini makeover. And, the most I've done is all the teeth. So it can run the gamut of anywhere between the least and the most. What we do to evaluate that is really look at the patient's face. We take models, we make molds, we get stone models of the patient's smile, and then from there, we can actually do a smile design. So we do what we call a mock-up or a wax-up on those models to kind of show what the smile would look like. So if we say, for instance, we want a broader, more feminine smile, we can create that on a model and then transfer it to the patient's mouth in temporaries. And then the patient can live with that and we make adjustments. So it's a very predictable process to get to where we want to get. And the patient feels more comfortable seeing every step of the way. Yeah, and that's an interesting question because everyone's case is super unique. Depending on what the needs are, timelines can vary from anywhere 3 weeks to 3 months to sometimes even 6 months, if we're healing from implant surgery. The takeaway, though, is at all points throughout that process, the patient should be and is aesthetically stable, meaning, they're never walking around with a clearly missing tooth. You always want to make sure that you have some sort of temporary in place, making sure that the patient's comfortable enough to step out into the real world, comfortable enough to eat. So, while some of these cases can take some time, especially with other procedures, periodontal and endodontic procedures that are involved. It's a very carefully planned out process with specialists, with our specialists, and through every step of the process, we do make sure that, the patient is stable. That's our goal. So we can't always know how long it'll take for a patient to heal. We can guesstimate, but, they're always comfortable throughout the process. I think that Instagram and social media definitely has its place. I think it can be used as a tool. I look at Instagram and social media from the lens of a business owner. How can I educate my patients? How can I just show what our business does, or our, brand identity? How can we use Instagram as a tool to sort of, get patients to see what we do and all of that? But you're right, there is a bigger purpose that we need to sort of educate a certain generation on, in terms of, there's more to it than posting what you ate for lunch that day. Yeah.